My name is Dr. Sam Sidney. I am a fellowship-trained orthopedic surgeon in the Baltimore, Howard County area. I've had the privilege of taking care of thousands of patients over the past 25 years in this area, being associated with Orthopedic Associates of Central Maryland. If you're watching this video, either you or a loved one has been told they might need to have a knee replacement. What are the indications of knee replacement? Most of the time, the most common reason a patient comes to the doctor is because of pain. Pain is usually what drives patients to their doctor, and once the patient's complaining of pain, we go through a process of identifying the cause of the pain. That involves a specialized examination and then imaging, which either would involve x-rays or sometimes an MRI. Once a diagnosis of knee arthritis is made, it does not mean you need to have a knee replacement. A lot of non-operative and sometimes less invasive things can be done. For the purpose of this video, we're going to assume that all those less invasive things have been performed and you've come to a point where a decision has to be made whether or not you need a joint replacement. Computers have become commonplace in all of our lives. How does this help us in the operating room? With computer-assisted surgery and robotic technology, we are able to create a model that is uniquely yours. In the screen, in the background, we have an image, and with the model, which represents your knee, we can create a digital image. With this information in the computer, the robot is then guided to make precise cuts that achieve perfect alignment, excellent ligament stability, and long-term excellent function. For the purpose of this presentation, this is a model of a knee that has been replaced. Let us work backwards and see how this is actually done. The diseased knee joint is exposed. The appropriate bone cuts are made. There are 5 cuts that are made on the femur, 1 in the front, at the end of the bone, and 2 in the back. The tibia is also exposed. Precise measurements are made, side to side, front to back, and the precise size is placed in the correct rotation. A femur is also then fixed to the bone. The pieces are then put together, restoring normal alignment, excellent range of motion, and stability. Some patients present to the office with severe deformity. Either they're bow-legged or knock-kneed or can't straighten their knees fully. In medical terminology, it's a valgus deformity, a varus deformity, or a flexion contracture. With the use of this computer, the information assists the surgeon to gain perfect alignment, excellent ligament balancing, and long-term excellent results. With any operation, there are risks which I'd like to discuss briefly. With any incision, the potential of infection exists. Prevention of infection begins way before the operation. You have to watch your nutrition. If you're a smoker, stop smoking. And skin preparation before the operation is important. Antibiotics are used before and after surgery to avoid and lessen the risk of infection. A new silver impregnated dressing is used, which is waterproof and does not need to be changed for between 5 to 7 days after surgery. This provides a seal that allows the wound to heal without any complications. One of the complications after knee replacement is blood clots. If you or an immediate member of your family has had a history of blood clots, you need to let us know. Expectation after surgery is actually determined by how well prepared you are before the surgery. By this I mean, when you've made a decision to have a knee replacement, I believe you're in training for your operation. You need to get yourself in the best shape physically, mentally, understand what the procedure is, and be determined to work very hard after surgery. Preoperative range of motion of your knee is a key determinant of how much motion you'll have after surgery. Try and gain as much motion before surgery so that you'll have an easier outcome after surgery. Right after surgery, your rehabilitation commences. In the hospital, we use a machine to start bending your knee. Physical therapy starts the day of surgery, where they get you out of bed, get you moving, and getting back into the swing of things. You need to be determined to work hard in therapy. That means gaining your strength back and working on range of motion. Your expectation is to be able to get around independently using a walking aid, sometimes a walker or crutches. A physical therapist will be coming to help you with your exercises at home until you're able to go for outpatient therapy. It's that determination to work hard that's going to carry you through the rough part of this recovery. One of the things patients fear the most after knee replacement or any operation is pain after surgery. We take a lot of steps during the operation to minimize pain. These steps include a minimally invasive approach, cutting less muscle, using medications which are injected around the knee that provide pain relief for between 48 to 72 hours after surgery, as well as the use of narcotic pain medications as needed. In summary, it's been my privilege to discuss knee replacement with you today. If you or a loved one is suffering from any knee pain, my team and I are ready to help you.